vu. Là, on était en train de parler de Chiangong Hair Beauty and Fashion. C'est lundi, Monday. Même s'il y a une belle coupe le lundi, on parle très souvent de psychotherapy, but I wanted to ask, good morning.
Good morning, my great friend. How are you doing?
Yeah, I'm good.
You've been away for a while. I hope you missed me.
A lot. No, so I wanted to ask, today we have decided all this week we will talk about the living together. That's very important to reinforce this living together, especially in the moment like this, where we see a lot of hate speech going up and down on social media and on TV. So I wanted to ask myself, and I wanted to ask you the audience, and that's why I will ask you the same question. What can be the role of the media, a media like us, like STV, in this crucial period concerning the living together? What role can we play in the maintenance or the reinforcement of the living together?
You build various types of communities, and you only get what you deserve. You know, you harvest what you sow. In the app, there's always a platform from which you can evaluate organizations. If you're looking on, you can say, let's look at families. You see some families where children are more grounded, they do well in school, they have beautiful relationships with each other, they have stable marriages, and they look healthy, and people live long in those families. And then you can go on to look at departments in the same region. You see some departments are clean than others. Behaviors, so you see in the case of families, who is the head of this family? Then you see the problem now is addressed to the head. When you go to department, you say, who is the mayor of Douala 5, Douala 3, you know? And then, of course, you can come to countries. And then you say, who is the president or the prime minister or the head of government of that country? So the reason why you discuss about living together when it is genetically programmed that humans should be social, it's not called for. What happened to the natural calling of our human dimension, which is that we should live in communities, we should love each other, we should hold each other, we should carry our babies 9 months in the womb, and we should stay near the babies at least for 10 years before we liberate them. You know, most animals, when they have the baby, is in an egg. It's not in the womb. And when it comes out of the egg, few months, everybody is free. The human carries the baby 9 months in the body until the baby is living. The baby comes back, clings to the mother and the family for a whole period, because the level of attachment is genetically, spiritually programmed to be stronger in the human being. So how come we are asking about living together? Because that's our program, which means that there is a very intentional, vicious act to make sure that people don't live together. That has been going systematically for a long time.
And do you think that we can use television or medias like this to remind people that your humanity, so as you just say, you have been programmed genetically to live together? So fine, maybe what is the role of the media like this?
Well, in a situation of, it depends. You have some patients who can go to the hospital and who can go to the pharmacy, get a drug and take, and they are fine.
Okay.
You have another one who will go to the pharmacy, to the doctor, consult, get a treatment. Another one will go to the doctor, consult, get laboratory examinations and many scanners, get a treatment. Another one will go to the hospital, he will do all the exams and will be hospitalized. You understand? And then he will get the treatment. Another one will be carried by emergency to the hospital. He cannot go. It depends at what level our disease is. Then the strategy for the solution will show. But you know, why I smile is because you are aware when to care based on how soon you should care, based on the amount of love that you have for that aspect you are concerned about protecting. In the case of Cameroon, we damaged this country nicely, progressively, giving other names for the damage we were causing. And then today we're trying to act as if we... The first thing and the most important thing is that let us identify the level of the disease. The solution cannot be some haphazard interventions diluted. I mean, if you want to canalize the sea and you have to take 10 years to plan it, because it's a body of water that is powerful and tremendous to manage. If you go with a teaspoon or a bucket and you start carrying the water because you want to reduce the seawater, you are a mental patient. If we diagnose the level of the gravity of the damage we have caused, and we may not be capable of doing it ourselves, which means we may need expertise from out of our system, because when you are not sure that you are making the right diagnosis, or if you think your problem, you go to see a doctor. So if we are able to identify a good expertise with some good willingness inside, we can carry out a process of evaluation of the level of damage. If we have made a good assessment of the level of damage, only on those basis can we program a mechanism or a set of actions for solution based on the gravity of what we want to resolve. Some haphazard, isolated, stains in terms of interventions, throwing left and right, may only be part of this very strategy that has brought us to the misery in which we find ourselves. But I want to say that every human being who has the basics about the human dimension and who is not getting alarmed by the fact that we have to, question our ability to live as a community, is also a mental patient. It's a mental patient. And, if somebody is a mental patient, you don't condemn them, you don't send them to jail. You send them for psychiatric intervention. You do all the necessary, interventions to be able to bring them first under control, and secondly to start a healing process, whatever, So what we are discussing here are very serious matters, and it's a call for everybody to really, maybe from my perspective, have another view of the situation.
Yeah, that is very important. And I really wanted to know. I wanted to start by the media, because we used to say that charité bien ordonnée commence par soi-même, and then we will question the other responsibilities.
Okay, listen. If I start giving you solutions, imagine that you were arriving the hospital with our initial scenario that we painted, Imagine that you are arriving at a hospital and you were anemic, you were in short of blood. You think they will be giving you blood tonics? They will be looking for transfusion. So let us not take part in this devilish act of deceiving the public. Let us not start saying something about what the media can do when maybe the person is needing an organ transplant. And then you start saying that, okay, let's give them blood tonics, let's do this. So we must be able
but since 2018, it's not like it's a new thing. So we know.
I don't know.
We know since 2018 there is a lot of hate speech everywhere.
I don't know if it is 2018.
No,
maybe 2018 it came to the awareness.
Yeah, that's it.
But it may have been maybe even at the onset of the creation of this country, Cameroon.
But something has to be done. I mean, 7 years after, look at where we are.
No, you're talking about 2018.
Yeah, that's it.
You are giving. I am not with you. I am saying that it may be a lot, much longer. And if you start resuming at 2018, there may be some more vicious bacteria or some pathogens, more vicious ones that are lying in from beyond 2018, who will just sit calm when you're finished, they grow up again and come back.
But we can start.
So we have to We have to start by
but we can start by there to create a treatment. Look, when in 2020, when this COVID arrived here, people don't care about when the virus started. They know that, okay, there is an emergency. We have to do, there is a lot of act that we have to carry, how we have to behave, like distanciation, using the mask. But I think at a certain point, we can let this situation grow.
You are seeing what was done, but you have not any idea of the mechanisms from the backyard, the expertise that was used to come to what was announced to you. You just took it. We didn't take part in
a lot of hesitation.
No, what I'm trying to point out to you is that let us suffer, or if you like, I belong to that team that wants to eradicate this problem once and for all.
Yeah.
I know that there are communities who don't have this problem we are having. You know, if sometimes you want to look for solutions, you want to go out, there are communities that don't have this problem. Can we look at their history? Can we? There are many exercises we can do. It doesn't mean that it will take many years for us to get the solution. It may take weeks, depending on the commitment of the actors and the authenticity of the seriousness and the refinement that and the level of engagement, commitment, and impartiality that the actors carry is going to be a very determining factor. I mean, you can create a platform. We can talk about this all day. It's about our country, and we love this country. So there's supposed to be no cosmetics about it. And maybe the hairdresser's point of view may be more impressive, more interesting than all the big agrégés and doctors and Harvard experts in how to diagnose every Sunday. They come on Cameroon TV to say the same people, the same things, and the same arguments, the same fight. It's not very appetizing.
Thank you, Mr. Chiango.
It was my pleasure.
Allez, you guys, thank you for watching us this day. We will talk about this social cohesion and vivre ensemble, living together all this week.